Why do doctors order repeated Atests for lupus? Doctors often order repeated anti-nuclear antibody tests when evaluating someone for lupus because a single test isn't enough to confirm or rule out the disease. The anti-nuclear antibody test detects antibodies that target the cell nucleus, which are common in people with lupus. However, these antibodies can also be present in other autoimmune conditions or even in healthy individuals, especially with age. Since lupus symptoms can be quite varied and sometimes overlap with other illnesses, doctors use the Atest as an initial screening tool. But because the test isn't specific to lupus, they often repeat it over time to see if the results change or if they align with the patient's symptoms. For example, if someone has symptoms like joint pain or fatigue and their initial Atest is positive, a doctor might order a follow-up test after a few weeks or months to observe any changes. Repeated testing helps doctors track disease activity and assess whether the autoimmune process is becoming more active or less active. It is also useful for monitoring the effectiveness of treatment or the progression of the disease. Additionally, since ANA levels can fluctuate, a single negative test doesn't always rule out lupus, especially if symptoms persist. In some cases, doctors will order other specific antibody tests, such as anti-double-stranded DNA or anti-Smith antibodies, to get a clearer picture. It's important to understand that ANA testing is just one part of a comprehensive diagnostic process. Doctors combine test results with clinical examination, medical history, and other laboratory tests to arrive at an accurate diagnosis. Because lupus can be complex and variable, repeated ANA tests are a valuable tool to help guide diagnosis and management over time. Always remember, if you have concerns about lupus or your test results, consult a healthcare professional. They can interpret your results in the context of your overall health and symptoms, ensuring you get the most accurate diagnosis and appropriate care.